I know some people claim that there's no heartworm up here in New York. I've even had vets say like it's not necessary for you to put your dogs if they're up here on heartworm preventative. So I don't know. What are your thoughts on that?
They're wrong.
They're wrong. Hi, Dr. Nelson.
Hello.
Hello. I'm sure you're a very, very busy guy, and I appreciate you taking the time to talk with us and answering all my emails and everything that you're doing, because it's really helpful. So thank you so much.
You're welcome.
We are hopeful to get some information from you and kind of share it on our social media and on our YouTube channel, just to kind of clear up any, any questions or anything that's going on with heartworm treatment and things that we see. So as you are aware, heartworms are super common in Puerto Rico. The tropical weather, the high mosquito population, obviously the southern states of the United States are all, red zones for heartworm. I know some people claim that there's no heartworm up here in New York. I've even had vets say like it's not necessary for you to put your dogs if they're up here on heartworm preventative. So I don't know. What are your thoughts on that? We'll start
They're
there.
wrong.
They're wrong.
They're wrong. No, there are heartworms in New York. There are heartworms in all 48 continental United States. There's less than the Northwest, but the Northeast is there's definitely up there. One of the issues is that heartworms are, especially in urban areas or city areas, or in pockets. Mosquitoes typically don't travel much further than 2 kilometers from where they're hatched. So it's not like I have a heartworm dog here and this mosquito is going to fly 5 miles away and find the dog. So if you have a heartworm positive dog in a area, the dogs in that area are going to be at risk. And the closer they are to that dog, the higher the risk they are. So there's been lots of studies done over the years looking at the what percentage of mosquitoes actually have infective larvae. And some of the early ones that were done like, somebody's got a kennel on the outskirts of town somewhere, and it's done in that particular area, or they're out catching mosquitoes in parks and things, and not necessarily in a neighborhood. And they were just looking at mosquitoes, maybe it's like around 2%. This was one done in Florida a few years ago. Girl named Tana McKay, she's an entomologist up in Arkansas, and in that particular area, it was like 7% of mosquitoes just catching out randomly had heartworm larvae in them. But if she went into a neighborhood where there was a heartworm positive dog, and those houses surrounding that dog, there's like 33% had infective larvae. And if she actually went into the backyard in the kennel area where that dog was, it was 72%. So the closer you are to a heartworm positive dog, the more you're going to see. So that's why we see things in pockets. A lot of times people would think that heartworms are going to be more rampant out in the country than they would be in town. Well, it's just the opposite. You'll find a higher concentration in town because there's more congregation. And those, there are some mosquitoes that can fly a lot further, but on general, they're usually kept in a small area. If you live in a town and say you went to, a real high upper end neighborhood, and the upper end neighborhoods down here in the Gulf Coast states and Southeast, they have estate-sized lots. Their lots are 3 acres, 4 acres, 5 acres, and houses are spread out. They're not, just right up against one another. So you can, when those little neighborhoods, heartworm transmission is very low, just because 1, they don't have a lot of stray dogs running around. 2, the dogs are so spread out, we're just not seeing the same amount. So they don't have the same risk factor. Okay. But if you're in a neighborhood that maybe is lower the socioeconomic scale. When you start looking at the fact that even in the Southeast, where heartworms are so rampant, only about half the dogs get any prevention at all. And these are half the dogs that are owned. And but other ones that are, but even about only 1/3 of those are getting, the true 12 months prevention. So it's constantly growing, expanding. You go back and look at Heartworm Society maps. Our first map was probably back like in 1980. And it was, high along the Gulf Coast, high along the Mississippi Valley, up the Atlantic coast. But as the further north you went, it dissipated. And the further west you went, it dissipated. So you went out west, you might see a few dots around Denver and a few dots out in California, but there wasn't a whole lot. But it's increased partly because people are mobile, and people from the Southeast moved out to California, moved out to Colorado, they took their heartworm-positive dogs. And then they also created environments for mosquitoes. You look at Arizona. People started moving to Phoenix, Arizona in the 50s because they had respiratory disease. They had asthma, they had COPD, they couldn't stand pollens and molds. We didn't have all the drugs we had nowadays. So they all moved out to the desert in Phoenix. Of course, they moved out there, and next thing they know is that they're missing home. So they start putting a little bitty flower boxes or little bitty small things in there with some plants they're used to. And then they started damming the rivers and irrigating and putting on golf courses. And now we raise up as much vegetables probably in around Tucson as we do in California, because they're all what they're doing. And they basically changed the environment, where now the pollen counts in Phoenix, Arizona rival Houston, Texas. So it's no longer a hyperallergenic spot. And then mosquitoes come in. Things that have been changing in the Northeast, back in the mid-90s, Sparky Locke, University of Pennsylvania, David Knight of Pennsylvania, they came up with this. They call it the Locke Knight model, and it had to do that you only needed heartworm prevention 6 months out of the year up in north because of cold.
Right.
And they based that whole study that you didn't get enough heat units within a 1 month period for a mosquito to develop infective larvae. And they based that on one, using Aedes aegypti, which in the wild is not a really big transmitter of heartworms, but it's used in the lab because it's easy to keep in the insectivores. And that mosquito basically only lives for a month. Two, they use the temperatures to make their lines where it needs to be, from basically the National Weather Service stations, which are usually on the outskirts of town. They're out the airport. They're not in downtown. And there is a phenomenon called the urban heat island effect, where you're in a downtown area where you have all the buildings and parking lots and concrete, which acts as big heat sinks, and they take in, absorb radiation from the sun, and at night they release it. So you could have a 22-degree difference from downtown and also out in the outskirts. And then you have storm sewers, storm drains, crawl spaces, microclimates where mosquitoes can get. And so where you will see a decrease in heartworm transmission in winter months, it doesn't go to zero, partly because there are other mosquitoes out there that live longer. In the mid-'80s, there's a mosquito called the Asian tiger mosquito, Aedes albopictus, who came in on a boatload of tires into New Orleans. It also about the same time came in a group of tires into Chicago, but these basically they were coming from Asia, and this mosquito was in there, and it basically got introduced to the United States, and that mosquito has since spread across the United States, really mainly started down around, New Orleans area, but spread up to what's off to the Great Lakes now. It's in New York, it's in New Jersey. That mosquito is an urban dwelling mosquito. So it's not in marsh, and it's a one that only requires a small amount of water. It could be, a little small flower pot or downspout of a gutter. Doesn't take a lot of water for it to lay its eggs. It lives for like 3 months, and it adapts to the cold, where it can even withstand freezing temperatures.
Wow.
And so, it will get cold, and heartworm development may stop. All you have to do is have it warm up for a little bit, which we frequently see during the winter time. It may be 30 degrees or 20 degrees, but next week it could be 60.
Right.
And if you have a, storm sewer, microclimate somewhere, other places warmer, that it can even, the heartworm development can continue. I did a project a few years ago. In fact, we pulled one of these things down right here. So this little container right here contained, so I get up there.
Yep.
It was basically a temperature recorder, and it was set where it could record the temperature on the hour. And we basically took 17 locations across the United States. We put one of those little temperature recorders like out near where the National Weather Service is, like outskirts of town. And then we put one like in somebody's yard. Then we put one like either in the crawl space. One of them was done at Zoetis there in New York, and they had like one in the parking garage. And we measured the temperature, hourly for 6 months, starting basically 1st of November going through April, and monitored and compared the temperatures. And where we would see these low temperatures out on the outskirts, you start getting in these protected spots that were significantly different.
Wow. Yeah. And with those urban dwelling mosquitoes, I guess that they love that.
And then if you have a situation where it's, so you have, people where they're drier than that from theirs going outside and pumping warm air into an area, and they've got some bushes right there, which makes a nice little microclimate habitat. So there are these places that occur where you will still get transmission, because these mosquitoes live longer.
Yeah. So it's definitely a myth that we don't need to treat up here in New York, New Jersey, and there is heartworm, and we need to do it all 12 months. Yes.
Great. We used to sit there, and Steve Ettinger is a very well-known intern of writes a lot of textbooks, and he's out in California. And he used to always tell me, he said, Tom, only heartworms we see out here in California are dogs that came from somewhere else. And I had to ask him, I said, so that sea lion down in SeaWorld that has heartworms came from Alabama? No, that sea lion got infected there in Southern California.
Right.
California is now, they said it's now that ranks the 10th numerous number of cases in the United States. It's California.
Wow.
So
wow,
it's out there.
Yeah.
Because things change.
Things change. So we need to
change. Mosquitoes change. We get invasive mosquitoes. We get temperatures that have become warmer. Mm-hmm. We're seeing more of these little warm spells in the middle of the winter time. Right. We just last week here had a significant outbreak. We had like 14 tornadoes in Alabama. Wow. In January. That was unheard of before. You would see it in the spring, weather changes, you would see it in the fall. Never saw it in the middle of winter. Right. But again, people may not believe it, but it's climate change.
Yeah. All right. So our next question is, what exactly is heartworm? And I guess we talked a little bit about how dogs get infected already, through mosquitoes, but can you give us just a little brief of what exactly heartworm is?
Well, heartworm is a flarenematode. It has to have an intermediate host. So adult heartworms are male females. They reproduce. Believe it or not, they have sex inside the pulmonary arteries. And because you have males, females, and so they produce microscopic embryos that are known as microfilaria, and they're circulating in the bloodstream, and they're about 7 microns in diameter, which is the same diameter as a red blood cell, and they go through capillary single file. So they're like 7 microns, and they're 7 in diameter, about 40 microns long. Mosquito bites and picks one of those up. It goes into the gut. While it's in mosquito, it goes through 2 molds. It goes in 2 molds, and you get first, to an L1 or from L1 to an L2, L2 to L3. L3 is the infective stage. And when a mosquito bites, and why it's biting, these infective larvae L3 are deposited on the skin in a drop of hemolymph. So a mosquito has almost like a proboscis, but it's almost like a little needle type thing, and it has a lip structure over it. And when it inserts that proboscis into the skin to draw blood, that lip part peels back. And when it peels back, there's this hemolymph drops out on the skin. And that is where the infective larvae are. It also contains some things that help to keep the blood from clotting, so whether getting the blood meal. It's also what makes you itch when you get bit by a mosquito. It's just the bite itself doesn't. It's just like no, you ever stuck with a needle. But then after it pulls its proboscis out, those infective larvae then swim or migrate down inside the hole where the bite was. They're not injected. They're basically deposited on the skin, and they enter through the wound.
Okay.
And depending on the mosquito and how many they have, you could, deposit 1, 2, or 6, 7 with a bite in that drop of hemolymph. And so the more mosquito bites you get, and the more infective larvae you have, the greater is the propensity of picking up heartworm.
That's interesting.
That L3 is underneath the skin. It quickly, within a couple of days, goes to another molt to what's called an L4, 4th-stage larva. It's migrating in the tissues. It's there for anywhere from, they'll molt from the L4 to the juvenile worm as early as day 50, 52. Usually by day 70, they're pretty much all molted by then. And at that point in time, they enter a vessel, and there's still questions whether it's a vein or whether it's a lymphatic.
Okay.
And the jury is still out on that. It's kind of hard to pick them up exactly, but your lymphatic system dumps into your venous system. So either way, that's how they get into the circulation.
Okay.
Our preventives work against the L3 and the L4. So when you use, and since they can molt as early as day 50, and they're entering into at that time they're in the bloodstream, and at that molt it's no longer an L4, it's an immature worm where they're not near as effective. That's why we have to give our preventions every month, because by 2 months they can already be getting into the pulmonary artery.
I see. So that's why every month it's really
Right.
important that we remember those days. Yeah.
And years ago they showed with ivermectin that it was less effective on a late L4. So it wasn't as effective on a 45 days as it was on a 30 day.
The preventatives are not as effective.
So that's
Okay.
why we need to give it every single month.
Okay.
Now there are other ones, now with like the ProHeart injection, you're constantly being slow release, so it's always in the system.
Okay.
But ivermectin, which is, was HeartGuard, TriHeart, Ivaheart, or milbemycin, which was Interceptor, both of those products are in and out of the system in 72 hours. There's no long-term residuals. So what you're doing when you give that product, you're killing, well, let's take that back. You're targeting what was exposed in the past month. Doesn't go forward, it goes backwards.
Okay.
Okay. It's excuse me.
Yep.
And there's also shown too that it's not just the drug itself that kills those L3 and L4. What the drug is doing is having it manifests itself by affecting what's called a secretome. So there's basically a little pore that secretes proteins that coat the cuticle that allow the worm to evade the immune system. So think about this. This little larva that's getting into the subcutaneous tissue, migrating around, it's a foreign protein. Your body's going to typically want to react and go crazy with that. If you get a splinter in your finger, a wood splinter in your finger, and you don't get it out, and it's down into the soft tissue, it will fester up. And you will get a little pus pocket and it will come out. Mm-hmm. If that was a little piece of glass or a little piece of metal, it just hurts. It doesn't fester up because it is not an organic substance. It's not a foreign protein. It's inert. Whereas wood is a foreign protein. With snake bites, the reason we have people react to snake bites, the venom, it's a foreign protein. And so more, when people get an organ transplant, you try to tissue match as much as possible, and then they're put on immunosuppressive drugs to keep them from rejecting the organ because it's a foreign protein. So that little worm, that little larva in the subcutaneous tissue is a foreign protein. That worm that's inside the pulmonary arteries is a foreign protein. But it is secreting proteins on its surface that allow it to evade the immune system.
Interesting.
When you give a macrocyclolactone prevention, its effect is on that pore, and it pretty much inhibits it from releasing the proteins, which allow the immune system to attack it. So it's the immune system that's knocking out really those L3, L4. It's not the drug.
Oh,
it's in combination of the drug and the immune system.
Okay.
There are some dogs that have never had a heartworm prevention in their life and can get exposed and never get heartworm. It's just their immune system, they just fight it off. I mean, you're getting bit by the same mosquitoes. Heartworms do occur in people, but it's very, very, very rare. Cats get bit by mosquitoes, and yes, they can get heartworms, but it's only like 1/10 the amount of time a dog can. And most of the immature larvae die when they get into the pulmonary artery and don't actually make it to adult worm.
So does that mean that the health of the dog has something to do with it, or is it more genetics?
Probably more genetic.
Okay.
Probably more genetic. I mean, there's some people that get every cold that comes around. There's some people who hardly ever get sick.
Right.
Has to do with the immune system. But there, like I say, it's a multifaceted thing. So when somebody does a quote slow kill, what they're doing by giving that prevention, they're keeping the worm from fighting the immune system. The immune system is attacking the worm, and it doesn't live as long. So instead of it living 5 to 7 years like normally, it's going to not live as long.
So let's talk about that, because slow kill is one of my questions. So this is a perfect entrance to that. So what is the slow kill method? It's where, well, I'll let you answer that. And do you think that it's effective or not?
So what's your goal?
So for us, for the Sato Project, our goal is to get the dogs heartworm free so that we can fly them to the States.
Okay. So if your goal is to get them heartworm free and fly them to the States, the quickest you're going to get one heartworm free with a slow kill is a year. That's the quickest you're going to get it free.
So slow kill, just in case people don't understand what that is, it's where you give a monthly preventative for a minimum of a year.
So when slow kill first came out, and this is where people are so prone to take things out of context. So John McCall, he's on the Heartworm Society board. You're one of my colleagues. He's probably done more heartworm research than anybody. And in 2001, at the Heartworm Society meeting, he gives information about how this was using ivermectin or HeartGuard. That if I had, like, or they infected some dogs, they waited to 7 months till you started prevention. We always want to start prevention in puppies, and that's not even a question. It's by 8 weeks. We want them when they first come in the door. 6 weeks is better.
So you can start, because that was another question. You can start puppies on preventatives at 6 weeks. You recommend 6 weeks old.
They first come in the door. Yeah.
Okay.
They first come in the door. You sit there, they're 3 months old, they come in the door with it. You start them on prevention. They may have heartworms the next year because you may not stop it. But what he did was, experimentally infected some dogs, and at 7 months started them onto prevention. And, if he gave like 100 infective larvae to a dog, and then at 7 months started on prevention, and then a year and a half later in he necropsy, there would be only like 6 worms. So it's 94% effective in keeping, how much they're exposed to. Wasn't 100%. If those worms were 8 months old, it was only 56% effective. So the older the worm, the longer it takes. So an adult worm, it could take 2 or 3 years just using a preventive. When we found out about Wolbachia, and just a little note there, since you're Puerto Rico, Bill Kozak, who was in Puerto Rico, was the one to discover Wolbachia.
What is this Wolbachia?
So Wolbachia is a rickettsial bacterial organism that lives inside heartworms. And it is required for that worm to thrive and reproduce and do well. So without Wolbachia, it does not, they don't live as long. They also can't reproduce. And any of the microflora that are exposed to the doxycycline, you eliminate Wolbachia from them, those microflora picked up a mosquito and introduced another dog will not transmit heartworms. So we can find ways to keep your dogs from transmitting heartworms quick. Just by giving them a month of doxycycline. They're not going to be able to transmit it anymore.
Okay.
If you use oxazoline on them, which is either like Nexgard, Simparica, Prevecto, those products, mosquitoes that bite those dogs, those mosquitoes won't live long enough to transmit heartworm because they will take in that drug, and that drug will kill the mosquito within 2 weeks. But what it was found, and it was some of the work was originally found in some of what Wolbachia was doing, and it's not just heartworms. There are lots of filarial nematodes that have Wolbachia within them, and it's a symbiotic, what's called endosymbiont. In other words, it's a symbiotic relationship. The Wolbachia cannot live outside the worm. It has to be in the worm to live, and the worm has to have it for it to complete its life cycle and do well. So it's a relationship they have to have. So if you eliminate Wolbachia from the worm, it will stop producing microflaria. It's not going to be as pathogenic because a lot of the metabolites from Wolbachia cause a lot of the pathogenesis of what we see from heartworm. So that's why now we give doxycycline before we give malarcimine, because we want to eliminate the Wolbachia. So when we kill the worm and all this stuff is released into the tissue, we don't have as many of these different types of metabolites and proteins and Wolbachia surface proteins that cause a lot of the pathology.
Okay.
So we have less pathology by treating with doxycycline first, because the The worm also quits producing microfilaria, and female worms are basically a big bag of microfilaria, and the weight of the female worm will be less. So she's going to shrivel down some and not be as big. So we have less proteins that are being spread out to the vessels when we kill the worm. So we cut down on pathology.
Right.
But when I asked what your goal is, my goal as a practitioner is to kill, eliminate all stages of the worm with as minimal complications as possible. That's my goal. I want to eliminate as many of, I don't want to have a lot of complications. So if you have a working dog, you have a police dog, you have somebody that the dog does agility, or somebody's field trial dog or a hunting dog, and you go in there and just a normal, say back before malarspine, we used caparcellate, or then when malarspine came out and you just went ahead and gave the injections and killed the worm, the amount of scarring that occurred in the lungs, those dogs never went back to the same level of activities they did before. They're alive, they're getting around, but the damage that we cause in the lungs is extensive. So the whole thing of the protocol and what we developed, in fact, the protocol that's in the Heartworm Society Guidelines is one that I developed in my practice. And it kind of morphed over years. You know, when malarspine came out, it kills so many more worms, causes so much more damage. We started using, and I was practicing on the Gulf Coast of Texas, we started giving prednisone to everything. And then when we started finding about Wolbachia, you know, I started using doxycycline back in 2004. Did some presentations, Heartworm Society in 2010. It wasn't until 2014 we actually put them in the guidelines. But if something I published and an article I published that was in the infectious disease books textbook. But the whole thing is trying to have minimal post-treatment complications. So whenever a worm dies, whenever a worm dies, these things are anywhere from 12 to 17 inches long in the pulmonary artery. And that thing dies, it's going to basically start decomposing. And it has to be cleared out of those pulmonary arteries. And the more proteins you have, the more damage you're going to have. But the other thing that's in there is another factor of how well a dog does and the number of complications they have. One of the biggest factors is activity. It's not how many worms so much as how active the dog is. So the more active the dog, the more problems you're going to have. So these worms are going to die. All right, they're going to die, and you're going to start decomposing, and those little bitty fragments are going to go out to the capillaries of the lungs. They'll start plugging off capillaries. And this dog's running around and increasing its cardiac output and trying to pump blood through those capillaries that are plugged. They're going to start rupturing and delaminating, which that's when we start seeing coughing and sometimes coughing up specks of blood. And radiographically, we talk about pulmonary thromboembolisms. Pulmonary thromboembolisms occur whenever a worm dies, whether it dies naturally or whether it dies as effect of giving a drug. When I do a slow kill, that worm is going to die, you know, by giving doxycycline along with a macrocyclactone. We, instead of it taking 2 or 3 years for the worms to die, we'll have them get them die within a year. I don't know when that worm's going to die. So if you have your dog at home, you want to keep your dog caged for a year.
I see.
So you can't restrict their activity to that extent. Whereas when I'm using malarcimine, we know when the worms are going to die. Therefore, that 1 month to 6 period week, we'll say minimum of 1 week, 6 to 8 weeks is probably better. After we give that stuff, we know the worm's going to die. When they're dying, we're giving prednisone to reduce the inflammation, and we're restricting their activity. So therefore, I'm causing less lung damage. So when you start looking at things that you can say whether or not there's damage going on. So we start looking at it clinically. You can't biopsy the lung to know for sure, right?
Yeah.
Those are all done in terminal studies, and we know what we're doing by doing these terminal studies, which we hate to do, but that's how you get the information. But if you probably one of the biggest things showing that when worms are dying and causing, inflammation, pneumonitis is coughing. Okay.
Okay.
So if you look at a heartworm positive dog and you give them malarcimine, and that 22% of those dogs were coughed. So that's an indication that we're having some issues going on. It's causing, worms are dying, it's causing inflammation. 22% are coughing. If we pre-treated them with a macrolactone for a couple months and then gave malarcimine, and we put them on pred, it was dropped down 18-19% of coughing. So we got some improvement. When we gave doxycycline and had a 1 month rest period, and we gave malarcimine with the 3 doses, and we gave pred, our coughing would drop down to 6%. Also, if you just look at just giving malarcimine by itself, mortality rates probably in around 4 or 5%. Mortality rate when we're doing it with the protocol, which is the Heartworm Society Guidelines, basically in this retrospective study we did, we went down to 0%. We didn't lose any dogs.
Wow.
So we decrease mortality, we decrease post-treatment complications, we decrease lung damage. So if my goal is to eliminate as many worms as possible with the least amount of complications, so far that protocol is the best one we have.
So real quick, tell us we know what the protocol is because obviously that's why I've been talking with you, but could you just tell us what exactly that protocol is?
So upon diagnosis, we start them on a monthly prevention, preferably one that's either ivermectin or moxidectin. Me personally only use ivermectin in that period. And that's because we have more data with ivermectin and the synergistic reaction with doxycycline than with any other drug. There was a researcher named Bazoki who showed that doxycycline by itself will eliminate Wolbachia from the worms. And Wolbachia, again, it's a rickettsial organism. Rickettsial organisms, Ehrlichia is a rickettsial organism. People get Rocky Mountain spotted fever, it's a rickettsial organism. But doxycycline will eliminate that. Ivermectin and doxycycline is more effective in eliminating Wolbachia than doxycycline by itself.
Okay.
So there's a synergistic reaction that makes it eliminate the Wolbachia better. We don't know if moxidectin does the same thing because nobody's actually looked at that to see the clearance of.
So moxidectin is which product?
Moxidectin would be either Advantage Multi, Simparica Trio, or ProHeart.
Okay. And
Also,
ivermectin is HeartGuard.
Ivermectin is HeartGuard, TriHeart, Iverheart.
Okay.
It's been around the longest.
Okay.
Millamycin Interceptor. The reason we don't recommend Interceptor, because if you look at using a prevention and what their effect is on an adult worm. Once a worm's about 4 months old, the millamycin has zero effect on the adult worm. So you take a dog with adult worms, and you put them on Interceptor and expect 2 years for the worms to be gone. It doesn't happen. It doesn't have any effect on the adult worms. So since it has no effect on the adult worms, we again do not believe that it's going to, in a slow kill product, using with doxy is going to have the same effect.
Okay.
Believe, we don't know. It may turn out you give doxycycline and millamycin may work better, but nobody's done it. There's no reason to make us believe it was, because millamycin has such little effect on adult worms.
Okay.
We do, ivermectin and moxidectin do.
Okay. So we have a dog test positive for heartworm. We start them on the 30 days of doxy and the preventative of ivermectin, preferably.
And preferably right now, it's going to be the 10 mg per kg twice a day. Okay. Because it's been shown in mycofilariae that takes the 10 mg twice a day for 30 days to eliminate Wolbachia. That's by doing PCR tests.
Okay. What is that you're saying? The 10 mix? What is it?
10 milligrams per kilogram.
Oh, 10. Okay. Sorry.
10 milligrams per kilogram.
Okay. All right.
A lot of people out there are talking about, well, some dogs don't tolerate that high dose. I mean, if you give it with food, there's usually not much of a problem. There's also a lot of people out there we've heard around here, they're thinking that it's causing liver toxicity. I just presented some data from a study where this was, again, it's only 30 dogs, but we were looking at 5 mg per kg, 7.5 mg per kg, 10 mg per kg. We also did liver enzymes on it, and we saw no effect on the drug with liver enzyme.
Okay.
So I'm expecting, although the dogs that actually had elevated liver enzymes with the drug actually had elevated liver enzymes before we started the drug. So it may have been just because of when you have a heartworm, you have heartworms, okay, the worms are going to die. When the worms die, they have to decompose and break up. They're cleared up by macrophages. Macrophages are cleared out of the body through the reticular endothelial system. In the cat, that's the pulmonary intravascular macrophage in the lung. In a dog, it's the Kupffer cell in the liver. So that dead worm was eventually have to get cleared through the liver. So that may be why we were having some elevated liver enzymes. And it wasn't the doxy, it's probably just from the heartworms itself. Because we found no correlation with the drug and the dose of drug and liver problems. Okay. So again, that's 30 dogs. So people that are saying that there's causing issues, it's probably not, it's morally well, it's not. There's things that you see, but doesn't mean it caused it. The causality are different things.
Right.
It's probably the heartworms that were causing it. But we know that in a study that was done just looking at collecting mycofilariae from dogs that were given doxycycline, it took the 10 milligrams dose to be able to eliminate it completely from the mycofilariae. We have a study we're still working on where we've actually got the adult worm for collecting, and we'll see how it's clearing there on there. But right now, the 10 milligrams per kilogram is the dose, recommended dose for 30 days.
Okay.
We currently recommend in that protocol is to have a 30-day rest period.
Yeah. So what's the importance of that rest period? Because this is something that's new for us even. And
so a lot of it when they were first done initially, when we first started using a macrocyclolactone beforehand, is we knew by giving a macrolactone, we could stop the female from producing microflare. She would get smaller, and the longer we did it, the smaller she got. So we always talk about doing anywhere from 2 to 6 months. The other thing is what effect in given melarsoline does it have on immature worms? There was no data on what melarsoline would do on a worm less than 4 months of age. So if you had a heartworm positive dog and you came in and you immediately just gave melarsoline, and I put it on prevention, and I had a 3.5-month-old worm in there, it's too old to stop it with prevention. And if I wasn't killing with melarsoline, a year from now I have an adult worm, because nobody had any data on the effects of melarsoline on worms less than 4 months of age. There has been one study with 5 dogs, not a lot, where it was given to dogs with 2-month-old worms, and it did eliminate them. These dogs also were co-infected with Brugia, another filarial nematode, and so there's a second variable in here. So we talked about how so much of our effect is immune system. So if I sit there and kill my Brugia, my 2-month-old Brugia, and I get my cause a lot of inflammation to get my immune system primed, will it then therefore have a better effect on the immature heartworm? It's a not complete. We don't have the true data.
Okay.
We know that if you sit there, if we know that heartworm preventions work up to 2 months pretty effectively. And so if I have a dog that has a 2-month-old worm and I give it doxycycline to have a 1-month rest period, and then I give melarsoline, by the time I give them melarsoline, the worm's at least 4 months old. And we know melarsoline kills 4-month-old worms.
Okay, so the rest period there allows the younger ones that weren't killed by the ivermectin.
And that was when that's when it was developed. That was the original thought.
Okay.
And why we did it that way.
Okay.
Now, with the little bit of data about melarsoline killing 2-month-old worms, it's a little bit of data. We don't know if it's 100%. But the other thing is that when we got that other data, we still decided to keep the 1-month rest period to allow time for the female worm to get a little smaller. Even though we may kill the Wolbachia, have we cleared all the metabolites from the worm when we kill the worm? And it was pretty much hypothesized by waiting a month that the worm would be smaller, and therefore we would have less metabolites. So we have recently, I presented some data at Heartworm Society meeting. That's pretty much what we've done. We experimentally infected dogs, and there were 6 dogs per group, but we had in there using the 5 milligram, the 7.5 milligram, the 10 milligram dosaging twice a day. After a month, after we finished the drug, we had one group of dogs that were sacrificed, the worms collected, the worms weighed, and we're getting, PCR for Wolbachia and all those worms. We also have the weight of the worms. We also have the lung pathology. Another group of dogs, we had a 1-month rest period in there, and we had the weight of those worms, and now we're getting the PCR. We do know that the worms do get smaller during that month.
Okay.
They did get smaller. It appears that there is less pathology in the lungs. That 1-month rest period allows some resolution. And we still wouldn't want to know whether we see less Wolbachia. So we're trying to determine, is this something, can we eliminate that 1 month?
Okay.
There are a lot of shelters that do not do the 1 month. Up in Canada, they're all pushing not just do it and immediately do it. But its question is, do we have, is it data driven?
Or just convenience? Yeah, because for us, we were like, oh no, now we have to keep these dogs longer,
we know that if you give, advantage multi, because advantage multi part about that is extremely high doses of moxidectin. It's real high amount of drug that's we put into those dogs. Don't know whether it's going to cause the worms to die any quicker. Because it's the immune system part. Because there's some stuff that was done years ago that John McCall said it didn't matter whether he did 6 micrograms per kilogram, 50 micrograms per kilogram, or 200 micrograms per kilogram with ivermectin. It didn't have any effect how quick the worms died. So he didn't think it was a dose related thing. I think it was just the effect of you're stopping it from producing the proteins and the immune system's attacking it. But so we don't know, but we do know that the study was done, the advantage multi, that was also done with ProHeart, that you do that with doxycycline, that you can probably eliminate the worms in 10 to 14 months. Okay, so if your goal is just to kill worms, then okay, you can do that. If your goal is to kill worms, if your goal is to have as least amount of potential side effects and complications or lung damage. So there was a slow kill study done where it was using advantage multi and doxycycline, and these were using on client-owned dogs, which are basically, you can't keep them in restricted. And 44% of those dogs were coughing.
Okay.
If the dog that just got malarcimine, it was kept by, still only 22% were coughing. So twice as many were coughing with the slow kill protocol if you give them malarcimine.
Okay.
And if you did the doxycycline, the rest period, and everything like that, it was down to 6%.
Wow.
So based on that, we would say there's less post-treatment complications with that protocol.
All right. So the protocol then after the 30 days rest. So now you have 30 days with the doxycycline and the preventative, and then you have 30 days rest with just the preventative, I guess, on that second month. And then, so then day 60, that's when we start with the malarcimine.
Right.
And we do 1 injection.
Right.
And then we wait another 30 days.
Right.
And then we do the 2 malarcimine injections back to back, day 1.
Yep.
I guess 90, is that day 90?
Yep.
91. Yeah. Okay. So 24 hours apart, we do 2 injections.
If you only do the 2 injections, that was one of your questions.
Yes, it is.
So in titration studies that were done looking at the efficacy when they were trying to find how to give malarcimine and what dosages, and they looked at, 1.5, it's 2.5 milligrams per kilogram of what the dose is, and it's done twice. When they were doing that, they gave those injections. They tried 1.5 milligrams, they tried 1.8, they tried 2, they tried 2.2. They got to have to get to 2.5. Or basically a 5 milligram dose within 24 hours to get a good kill rate. If you drop down to 2.2, your kill rate drops. You drop to 2, it drops really significantly. And then when it was originally, stuff was originally done, they gave 2 injections and came back in 4 months and gave 2 more injections. The split dose of giving 1, waiting a month and giving 2 was kind of the compromise. 2 injections by themselves will kill 80, well, it kills pretty much 100% of the male worms.
Okay.
It kills 80% of the female for 90% reduction. That's what you're getting, 90% reduction.
Okay.
3 out of 6 would seroconvert to negative on an antigen test in 6 months.
So you would retest these dogs in 6 to 9 months, and then they would be positive
They
again.
would still be positive. So because you're only killing 90% of the worms.
Okay.
By doing the protocol, you know, you're getting like 99% kill.
Wow. So doing the first injection, waiting 30 days, and then doing the 2 back to back, you're at almost 99% kill.
Yeah.
Wow. And that's our goal.
So, so yeah, there's going to be, and that's, you know, and that doesn't mean that so if I sit there and say, you look at the average dog infection, average, and this is even on the Gulf Coast, is anywhere from 14 to 18 worms. Because once they get a few worms, the immune system's kicking in, and they don't get as many each subsequent year. It's not like I get bit and I get 3 or 4 this year, and 3 or 4 next year, 3 or 4. Then by the time I'm sit there and you see with 5 or 6, they have 100 worms. That's usually not the case, because once they start having a few worms, they start picking up less and less because of the immune response. Okay.
Okay.
And that's why the people over years have tried to make vaccines. And they've actually made vaccines, and they just weren't effective as a macrocyclic active. They weren't near, you know, the high, almost 100%. They were less, not, they didn't do quite that high.
Okay.
But so the average one, so if I sit there and say my average is 20 worms, and I have 5 dogs, that means out of those 5 dogs, 1 worm may survive. You know, and it's probably not going to be very healthy either.
Okay.
And even if it did survive, and it was if it did survive and it was a female, it's going to be, well, if it's a large dog, you probably won't need to detect it. If you did detect it, how big a problem is it? You know, do you want to go through more drugs to kill 1 worm?
Right.
It's going to die eventually.
Right.
Our biggest concern, you know, is we sit there, and we used to sit there and recommend we would do a test at 6 months after treatment. Now we're going out to 9.
Right.
Because our tests have become so much more sensitive. They're picking up more, you know, lower and lower levels. There was, you know, way back in early 90s, there was a study done looking at comparing test, and the Check well test, but most all the reference lab uses, they weren't getting 100% until they were well up 11 worms or more. And in 2001, it was getting 100% at 3.
This is with the SNAP test.
This was with the Check in the lab test.
Okay.
You know, in lab test, but at that point back then, the SNAP, they didn't have the SNAP. It was the site. It was called the Probe. But the SNAP test, they're picking up probably, you know, down to, you know, easily 3 worms. But that's those are things that you have to. Well, so you're looking at, when you're doing a test, you're looking for, you know, how much the antigen in blood. So you have more female worms, you have more antigen, right? So it was going to take at least 3 female worms to get 100%. Well, they're doing all the studies are done on basically beagles, which are about 10 kilograms or 20 pounds. So if it took 3 worms in a 10-pound or 20-pound dog, a 60-pound dog has 3 times the amount of blood. So it's gonna be more dilute. So it does.
I see what you're saying. Yeah, the size of the dog depends on the.
It's blood volume.
Yeah.
So it's blood volume. You'll have more blood, so it'd be more dilute. So it probably takes more worms. Again, nobody's ever actually done that because the cost of the studies are so expensive.
Okay.
But that's just one of those things. But again, it's just but a lot of ones could be still positive at 6 months, but they're negative at 9.
Right.
Because we think they're just the tests are so much more sensitive than they used to be. They're picking up less and less amounts.
Okay. So after the dog receives the last 2 injections of the melarsoline, then how long, then what? They have to rest for how much longer?
They should be a minimum of a month.
1 month.
Minimum
of 1 month.
Minimum 6 to 8
Okay.
weeks to be better.
Okay.
If you were wanting that dog, if you're wanting that dog to go out there again, when we sit there and are writing the protocols and the guidelines, we're sitting there having to think, one, worst case scenarios. There's no way in the world for me to sit there and tell you how many worms that dog has. You can't.
Yeah.
You can't. I got the dot's really blue. It's bright blue. That dog could have 2 worms. A worm just recently died and released a whole bunch of antigen and makes it a really high level.
Okay.
Whereas I can have one that's faint and they're a bunch of immature worms. They're only 6 months old. They're not producing a lot of antigen yet. There's also situations where you get antigen antibody complexes where the immune system is reacting, especially if they're on a prevention, where it's causing them to react and they'll bind the antigens. There's less of a circulation.
Oh.
So there's no way to really determine how many they got. And since the worms are in the pulmonary artery, they're not in the heart. Doing an ultrasound echo, they're way out there in the arteries. You don't really see them unless they're massive problem, or they have some other things going on with decreased cardiac output.
Right.
Now, if it's a small dog, yeah, you could. But if it's a 50, 60-pound dog, no, you can't.
Yeah.
So there's no way to tell. So we have to sit there, and the protocol is designed for worst case scenarios. Some dogs will get away with a lot less.
Okay.
But we don't know which one's going to be what. So the last thing I want to do is the dog only has 3 or 4 worms. I'm only giving him 2 shots, and then it doesn't clear, and you have to come and get more.
So as far as transporting dogs, because that's kind of what we do, we move dogs off of the island up here. What do you recommend for testing? So say we get a dog and our protocol is day 1, they come in, we do the snap test. Obviously, if they're positive, we follow your protocol now. So we start that immediately. If they're negative at time of intake, is that safe to say that they're negative, or should we do another test, before they fly? Because then they have to still finish their 45 days of vetting for our protocol.
Doing a microflare test, because there's going to be, and this has been shown at a lot of different shelters. Now, of course, this has also been shown at shelters in the United States, which is probably different from shelters in Puerto Rico.
Yeah.
Shelters in the United States are going to probably have a higher percentage of dogs that may have been owned before.
Okay, I see what you're saying. Yep.
Different reasons. The grandmother's dog died. I don't want the dog. I'm moving. I can't have it here. It's destructive. It bites. Whatever reason. And it winds up in a shelter. And so that's also could have the possibility of, it may have had some prevention in the past. Mm-hmm. So we don't know, but you really never have all that history on stuff. But this whole issue with the antigen antibody complex, some studies have done in looking at shelter dogs that, were testing negative, that upwards of 7% were testing positive after doing what's called a heat treatment, because that can break the antigen antibody complexes.
Okay.
Or they may have circulating microflaria. Do a microflaria test.
So we do the SNAP test and the microflaria test at intake. Right. And sometimes we do have dogs test positive for microflaria that are negative on the SNAP test.
Right.
So then
what? So that could be why. Because you have antigen antibody complexes. And if that had a heat treated on there, then you could if you had a heat treated test, then you could find out for sure.
So then you would recommend at that point to send it out to do the heat treatment.
Yeah. I mean, you can do it yourself. It's not, but it's probably easier to send off, because what they're basically doing is heating serum, and the serum will basically almost turn to egg white. If you can mix it with some EDTA, it keeps it from clotting completely, but you got to get it they really prefer 104 degrees centigrade, which is above boiling.
Okay.
So it's probably better just to send it out to be sure.
Yeah. Okay.
And Antec, IDEX, all could do heat treated ones in there.
Okay.
But if you have microflaria, yeah, there's always a possibility as a microflaria from something else than heartworm. Okay. There's acamphicaenema, which you can have circulating microflaria. And there are ways to tell the differences. The people that look at a lot of them, which one's what. But then it has to do with the shape. There's the head's a blunt, there's a tapered, if it's a blunt, there's a tail curve, is not curved, how long it is. And, side by side, you can tell it, but getting that level is probably a little bit more difficult. A knots test is simple. A lot of shelters don't want to do it because of using formaldehyde. Now, it's used at such a low percent, 2%. It's what we use. We put tissue in 10% for histopathology, but we did a thing that I actually, something I had played with, and I gave this over to Chris Evans, his parasitologist at Georgia, for his. He needed a paper of using glacial acetic acid, which is basically vinegar. Oh. But using it at a 2% solution, it will lyse the blood cells, and then you spin it down and you pour off the supernate, and then you put what's the little stuff at the bottom on a slide, and you look at it looking for the microflaria. I mean, you can do a blood smear and look for them. It's just that's just a drop, whereas the other one's concentrating it. It's a concentration test. So by taking 1 cc of blood, and with 9 cc's of either 2% formalin or 2% acetic acid, then it just lyses all the blood cells. And then, you spin it down in a centrifuge, then, you pour off all the liquid, then you at the very, very bottom, there'll be a little white buffy thing, and you just get that freed up either by thumping or taking a little stick down there, freeing it up, put that on a slide. You can put a drop of new methylene blue. I've always just put them on the slide by themselves. You can see the microflaria in there. Okay. And you'll just concentrate, and you're more likely to pick them up. Okay. Because you're getting not a drop of blood, you're getting a whole cc of blood, so you're going to have more in there, and you concentrate them, you're less likely to miss something. Okay. And it's the protocol is probably in the guidelines about how to do it knots, and but you could say, if you instead of using formaldehyde, you can use acetic acid. Okay. So you would recommend that over the blood smear for the microflaria test? Yeah. Okay. I would recommend a blood smear, because just the blood smear, if it's there, you'll see it, but if you don't see it, it doesn't mean it couldn't be. Okay. Because you're only looking at 1 drop of blood, you're not concentrating them. Okay. All right.
So we have had a few dogs that we test positive for heartworm, test positive for microfilarial, go through the whole treatment, and then they're still testing positive for microfilarial.
Okay.
What are your thoughts on that?
Well, if you gave the doxycycline,
Yes.
Those microfilariae are not going to be able to be transmitted and develop adult worms.
Okay.
But without Wolbachia, it stops the cycle.
So they will die on their own eventually?
Yep, they will.
So do we
There-
need to continue?
There are macrocyclic lacto resistant heartworms out there that the drugs don't kill them.
Okay.
There are ones that are out there, and there is a way. I mean, if you had a whole bunch, and of course, by doing the knots test, you can tend to have some degree of quantitation. I am doing but if I do it the same way all the time, if I take 1 cc of blood, 9 cc's of formalin or acetic acid, spinning it down, taking taking out that little button that's at the bottom, getting it freed up, putting some on a slide, putting a cover slip where it spreads out, and then I just look at there and how many microfilariae I see, per low power field. Like I see 10, or I see 20, or I see 4. And then by giving a macrofilaricidal dose, again, the Advantage Multi is the only one that's actually FDA approved for that. And then you come back in 2 weeks and do another knots test. If you see a greater than 50% reduction in the microfilariae by numbers, that's just by counting per high power field, they're probably not resistant. If you don't see a whole lot of change to it, then you probably have a resistant isolate.
Okay. But even if they are resistant, they still would eventually die off on their own since we gave the dog.
If you gave the doxycycline, right. If you gave the start with the doxycycline, that will pretty much keep those things, like I say, they can still live. They'll be in circulation. A mosquito can pick it up, and it can even become an L3. But if you put those L3 into a dog, they will not develop to adult worm. Okay. So once you give the doxycycline to those dogs, and you gave a dose of oxazoline, you can transport them because they're not going to be carriers. They still have heartworms, but they're not going to be carriers.
Okay.
They're not going to transmit it. So you can bring them in, and they're not going to sit there and infect other dogs.
And that would be really good for the shelters where you're saying there's like those concentrated areas where if there's one dog that comes in with it, it can spread to everybody. If you have a dog that's testing positive, it'd be safe for them, even if they can't do the full treatment, to just do the 30 days of doxy.
No, I mean, at that point in time, they can be transported.
Okay.
After your 30 days of doxy.
Okay. So that's actually something that I have on here too. What precautions should we be taking with transporting a dog? So as long as we're testing them at intake.
Yep.
And treating with doxy if they are positive.
Yep. That
would be the minimum.
Yep.
Okay.
Yeah, and you can transport them safely. That's what we after Hurricane Katrina, they were transporting 40,000 dogs across the country. That's pretty much the protocol we put in place, was get the doxycycline into them, and you can transport them because they will not become a carrier. Did you just treat everybody with doxycycline, or did you test and only treat the ones that were positive? No, they were tested. They were tested. Okay. These were coming out in New Orleans, and 60% were positive. So it was. Yeah, we know that feeling. I feel like 1 out of every 4 adult dogs that we bring in, that's what the number was last year, was positive. So so another question, a lot of times we do the radiographs on the heart and the lungs. So what's your recommendation for that? Like, how often should we be doing them? When should we repeat them?
How many views should we be doing? And then also sometimes there are changes to the heart and the lungs, and we have to kind of explain that to adopters then. And is that, you know, what kind of damage is done and precautions should they take for a dog, for someone that's adopting a dog that has been treated for heartworm?
Well, if you're going to, I mean, you have, well, first of all, you may see some vascular changes in there and some scarring in there, and I can show you pictures of ones with where they got calcification and all kinds of issues in a large thing. And so there are, you know, more, I mean, they're not going to have the same ability to you know, sort of athletically. But once you eliminate the worms, and yeah, I have some enlargement, I have some vessel change there. We're basically probably talking right-sided, and even though it's the damage is there, they're not going to typically have a lot of issues clinically long term, other than not having the stamina. Right-sided heart failure, I mean, left-sided heart failure is more we're going to be clinical and what things are going to go on, but that's not the issue in heartworm.
With her. Okay.
It's right-sided. So, and typically, as far as radiographs, if a, and this is what's your minimum database. So one, if a dog is doing well clinically with minimal signs, you have to look at resources too. If your dog is doing well with minimal signs, we treat a lot of dogs without radiographs and blood work ahead of time. If they're clinical, I want to see what's going on, but it's not going to change how I treat them. The reason the protocol, and so when we first started talking about using doxycycline, and we were finding out about Wolbachia, and it's doxycycline is used to treat river blindness in people, or prevent river blindness in people, and for other flare nematodes and the lymphatic filariasis that people get. Doxycycline is all now part of the treatment. In what we were doing and seeing so many reduced complications, when I first started using doxycycline in 2004, I was using it on class 3 dogs. Ones that came in that were coughing, sucking air, see every rib, the heart sound like a washing machine, the ones that we tend to lost in a treatment. And we started treating with doxycycline, and they were all surviving. And we think, well, they're doing this well on these here. Why don't we treat them all with doxycycline to see if we reduce the things? And so we, you know, we're treating all of them the same way, because then we don't know who's going to have what problem. You can have a dog that looks perfectly normal with everything looks okay, and you give it 2 shots of melarsoline, and next thing you know, you killed the dog because you killed so many worms. Yeah. By all this pre-treatment, we've gotten rid of some of those different things, got rid of those bulk of those complications. So it doesn't change if I see radiographic changes in the lungs, heart and lungs. It doesn't change how I treat it. Now I've had a swollen abdomen, or I had some really significant coughing, then yeah, I would like to have chest films, and yeah, I may do some other treatment. It looks like I could be, you know, having some really big enlargement on that right side, which could be causing some pulmonary hypertension. Then I may, you know, add sildenafil to those dogs. But the everyday heartworm treatment dog, as far as taking x-rays multiple times, is just added expense. It doesn't change how I treat it. Okay.
So if there's no clinical signs, you don't.
If it's not going to change how you treat it, then it's an expense you don't need to incur, in my opinion.
Yeah. Well, we respect your opinion. Thank you. All right, so that's good to know. And then what about spaying and neutering? So a lot of times this was like a question where you're like, where in this process, do we do any surgeries that might need to be done, primarily spaying and neutering?
First off, before you do anything, do it first.
The spay and neuter.
Mhm.
Before you even start the doxy?
Well, I used to sit there and probably say, no, not before you start the doxy, but now based on what we're seeing with this study that we're seeing some worm death, even with the doxy, even after just a couple of months. Yeah, probably it'd be best if you get it beforehand.
Okay.
If not, then you probably ought to wait till after you finish treatment.
And
Like
so how long
months,
after?
like 6 months after molar spawning. If you're going to treat one and you're going to spay one, you need to. So, what's your anesthetic protocol now?
Sarah, maybe you can tell us, what do we use for the anesthesia?
So we use propofol for heartworm-positive dogs.
Just propofol?
Yes, we don't use dexdomitor anymore.
Yeah, you definitely don't use dexdomitor on a heartworm-positive dog.
Okay.
You can get it. You may wind up with a cable syndrome with
Okay.
that. What you can do, and I can email you like some protocols, like on heartworm-positive dogs, drugs you can do. You can, I mean, I typically would use a combination of pre-treat. I use either hydromorphone or butorphanol with lidocaine.
Mm-hmm.
And by pre-treating with, I use butorphanol mainly because we have a lot of it. It's not as high a control drug as hydromorphone, but using butorphanol at 0.3 mg per kilogram with lidocaine, basically cc per 20 pounds as a pre-med, it allows me to cut my propofol dose down to like from 7 milligrams per kilogram down to 3 to induce. So it's a lot. It saves a lot of money too.
Okay.
With the lidocaine has also some good benefits of stabilizing heart. Because if there's any inflammation, because it's, I mean, we use it for arrhythmias and tachycardias, and so it just helps, puts that in there. But I could email y'all. At our last meeting, there was an anesthesiologist giving all kinds of drug things and all about to use. But yeah, definitely don't want to use dexmedetomidine in there.
For any dog that has heartworm, even if we didn't start treatment.
Even if you don't start treatment, because it can decrease the cardiac output. And I had one here just recently that it was spayed, tested positive. They started it on Advantage Multi and Doxy like on a Thursday. It came in our practice on Sunday with a murmur and the right chamber full of heartworms and the cable syndrome. It hadn't yet got so bad that with sildenafil and then some pred, we were able to get them to move back. And now I went through a treatment and everything's fine.
Okay.
But once they get down into that tricuspid valve and start decreasing output, you can get in trouble real quick. Okay. And those ones have to be surgically removed.
Yeah. Okay. Wow, that was a lot of awesome information. And Sarah, do you have any other questions that you can think of? No, you're good. All right.
I will send you those protocols.
Yeah, that's amazing.
On anesthesia and just I email them to you. And that way you can have that to look at.
That's great.
Okay.
Thank you. Thank you so much, Dr. Nelson. I really appreciate this. And I know, we've changed our protocol and we're hoping to kind of spread the word to help, everybody else handle this better. And
well, I mean, there are, like I say, you can kill worms quicker. I mean, well, you can kill them quicker by not doing all this pre-treatment stuff. But I just start it, give 1 dose, and then come back in 2 months and give the 2 doses. Because I recommend 3 doses in all of them.
Okay.
If you work on do the other stuff, and you can kill more worms, it's just that if your goal just to kill the worm, it's your goal to sit there and have less post-treatment complications.
Right.
And then again, you know, it's a money, and you know, it's time is money, and having to keep the dogs takes longer. It just, one works better than the others. There are, you know, we can get rid of worms and quicker other ways, but we're going to have, there's a trade-off.
Yeah, you know, one of the big things that we kept seeing, which is the whole reason I reached out to you in the beginning, was that we do follow up with all of our dogs that had heartworm, and they, you know, so I personally reach out to the adopters to make sure that they do the recheck. Well, we were doing 6 months after, and we were having a lot of dogs coming back positive after we were following just the regular protocol, which we thought was one treatment, and then a month later do 2 more. So that was kind of the reason that I reached out to you. So we're hoping now that we've started, you know, the rest period and everything will will eliminate that, and you know, have a higher success rate of not having dogs testing positive and having to go through the treatment again.
Well, it's very important that, you know, one, test at 9 months, not 6, after treating.
Yeah.
And it's very, very important that they get the full 2.5 milligrams per kilogram of larceny. Sometimes they sit there and say, well, let's, you know, the dog weighs 48 pounds, and I have to, you know, open another bottle, let's see, because one will do 44, and oh, it'll be okay, and underdose it. It's not. You need to use the full 2.5. When the actual treatments were done, they gave the 2 injections the same day.
Oh,
One in the morning, one in the afternoon.
wow.
And because actually it had even a higher kill rate then. The reason they're spread out apart just is to do for the soreness from the drug.
Yeah.
And giving it, but and they even gave 5 milligrams one dose. It does a good job of killing worms, but there are some dogs that has got a lot of inflammation in the lungs from it. But it's cleared out of the system in 6 hours.
Okay.
So the drug's gone in 6 hours. So doing one in the morning and one in the afternoon, can be done.
Okay. Okay.
Okay.
All right. Thank you so much.